Oh, he just spit up. He's still asleep, but
I'll wipe it off. I think he was just having some rapid eye movement.
Yeah.
While awake, you know?
Yeah.
Okay, we're good to go.
Okie doke.
So, this will be our birth podcast.
Yeah, I know. I want to say birth vlog.
I know, I want to say
So
birth
we
vlog.
watched a bunch of birth vlogs.
And I might include some clips or whatever here. We'll see if I upload this one with the image. But
we're like almost a week post.
Yep, he's back up to birth weight already.
Yeah.
Little champion.
Yeah, so last Tuesday at about 5 o'clock, I started laboring, I was on the couch and I was like, ooh, these contractions are getting stronger.
Mm-hmm.
I think things are happening.
Yep.
Felt like that night might be the night.
Yep.
But there's still so much like question at the beginning. You're like, is this really labor?
And you had your bloody show happen.
Yeah. Well, it was like an underwhelming.
Yeah.
It was,
But there was some blood that happened.
Yeah. So it was hard to tell, like.
But we already knew that you were 4 centimeters dilated.
Yeah.
From Thursday the week prior.
Right.
So kind of expected that things would happen fairly quickly.
I was like, okay, we're having some blood. I'm contracting more strongly. I'll start tracking this. Shelton was like, okay, let's pack and go to the hospital. I was like, we're not going to the hospital yet.
I had a haircut scheduled at 6:30.
Oh, yeah. You were going to go get, 5:30. You were going to go get your haircut and go to jiu-jitsu. Or, no.
I was planning on going to
Hobby Lobby or something.
Frank's class.
Yeah.
I will be Mr. B, Shelton Mr. A, the drunk guy. Shelton is sober today, so everything's going to be okay.
Yeah.
And I was like, you can go get your haircut and then come right back.
Yeah.
I think that's about all we have time for.
Yeah, so I went and got my haircut at 5:30, and Rael was like, what are you doing here? She clipped it real fast. Yeah. But I was like, we're not sure if she's actually in labor. It's still a couple days before. And the due date was Friday.
Right.
And this was Wednesday.
Tuesday.
Oh, Tuesday.
Yeah.
Oh, that's right. Yeah, it was Tuesday night. Yeah, so I was kind of like, I'm not sure. But like I said, you're already 4 centimeters dilated. You had been doing the Primrose capsules.
And pumping every day.
And
I went to acupuncture that morning.
Oh, yeah.
And I had an appointment at like 9 a.m. to like see if he could help induce contractions. And so he did like a different setup than we ever have done and like put some acupuncture where I knew there were pressure points from the pressure point book that someone had given us or let us borrow.
In your ankles?
Ankles and between the thumb and the first finger. And then he came in like every 10 minutes and wiggled the needles around to stimulate things. And he did that. We did that for about an hour. And I had a little bit of cramping during the session. And then I went home and pumped. And then we just kind of hung out for the day. And then like 5 o'clock things started. So.
Could have been that.
Could have been the acupuncture.
There's been some weird stuff with acupuncture. There's been, just like some healing stuff that I'm like, if it wasn't acupuncture, what was it?
Yeah.
Yeah. It's been really good.
So I bounced on the ball for a while, just tried to like be comfortable. And then the first hour, I was contracting like very often. My app was like, go to the hospital, but then things slowed down in timing, but picked up in intensity. So we stayed home until about like 8 o'clock. Mm-hmm. And then I called Sarah, one of our friends who's a family medicine doctor, and kind of checked in with her because I tried to call L&D and they're like, we can't give you medical advice. I'm like, okay. Mm-hmm. So I checked in with her and she was like, yeah, might as well just go get checked out. So I went to triage to get checked out and I was only like 5 centimeters. So I hadn't made a ton of change since the last visit the week prior.
We went to triage. We went there about 8.
It was like
9,
8:45.
Yeah.
And the contractions were getting stronger, but still like not necessarily picking up in timing.
But your blood pressure was higher than it's ever been.
Yeah.
It was like 140/87. It's
Yeah.
kinda high diastolic.
And he was tolerating everything fine. He was fine on the monitors. And so we wavered between sending us home to labor longer versus admitting. They kind of gave me the choice at first, but then the doctor came in. She's like, well, I didn't see these blood pressures. I don't love them being. So she was like, how do you feel about just staying and monitoring? And I was like, that's fine. Like, let's just stay, which is good that we stayed because it was like
real good.
An hour and 15 minutes later that my water broke and things progressed quickly.
They got you settled in the room, or they moved us into the room. And then they tried to start getting IVs on you.
Yeah, they wanted to check my labs because of my blood
veins.
pressure and make sure that like my kidneys weren't, being affected or anything.
Yeah, and you've got great veins, but maybe it was because the pressure was higher.
Yeah.
They blew like 4 or 5.
Yeah, 4 veins.
Yeah.
They kept hitting valves or something.
You still got bruises on your arms.
I was the least of my concerns at the time. They were all, kind of like embarrassed about it because I work in healthcare and, I'm like, really, it's no problem. I could care less at this moment because these contractions
were getting stronger.
Yeah.
Like during that hour 15 that they were, like it took a long time for them to get that all sorted, to get a line in.
Yeah, just get everything settled, get my, bracelet on. They were, doing all the normal stuff and things just like progressed quickly. And so once they finally... the third nurse came and got an IV in my bicep. We got labs and all settled in. She was like, okay, I'll come check on you in like 30, 40 minutes.
I went down in that time and moved the car and brought the bags up, but there was like just enough time to get all that done. It was like an hour 15, like you're saying. Yeah.
And then like the second she stepped out of the room, I felt like an internal, like the pop sensation that people talk about, and then the gush of fluid.
Yep.
And I was like, oh, I think my water just broke.
Yep. And you were on your side, and all of a sudden you were in a pool of bloody water.
Yeah. I never even saw it. I don't even know what it looked like.
Yeah. You were eyes closed, laboring at that point, or pretty much right after that.
Yeah. Yeah. I couldn't open my eyes. It felt like I was just in a pain cave.
Yep.
But, so she had just stepped out of the room. So I was like, Shelton, go tell her. So she like did the little swab to make sure it was, my fluid and not my bladder or something. And she was like, yep. And then, I don't really exactly remember what happened after that.
Right after your water broke, your contractions got a lot worse.
Definitely. That was, the intensity changed immensely after my water broke.
And she came in and she was monitoring the baby and had the monitors on there, and she kept having to move them around a lot.
They can,
as they were coming out of place.
I didn't have any like meds or anything at that point, so they can just do intermittent monitoring. So she would come in and check and make sure his heart rate was fine, watch
and
it for a while. And his heart rate did
drop down for several minutes to like in the 90s whenever you were turning and trying to adjust, but she also couldn't quite get it where he was getting pretty low. He was
so low.
She was like putting it real low.
Yeah, they couldn't get a good reading.
But you were like writhing, you're up on your knees in the bed. I started to draw a bath at that point. We had talked about, you had talked to the nurse. They asked you what your goals were with medications before. Yeah. And this was like, 20 minutes before all this.
Yeah.
And you said...
And I was like, well, I'd like to try without and just see how it goes. I'm open to an epidural. Like, I don't, this is my obviously first time laboring. So, plans may change. I don't, I've never experienced this. And they're like, yep, sounds good. Like, these are your options. And it just got very intense very quickly. I was like on all fours. That was the only position that like I wouldn't say helped, but that I could tolerate.
Yep.
And I like
doing the animal groans a lot. Things got real primal real quick.
I think I was trying to like get upside down to try and like relieve that pressure sensation like in my pelvis. It didn't really seem, I don't know. That's what it seemed like, but it was all very minimal benefit.
The bath was like 4 inches drawn, however you say that, or 4 inches in the tub.
Yeah, and I didn't want to get in the bath.
I know, but
Shelton was trying to
Well,
encourage
yeah.
anything.
Well, we had talked
try
about
anything.
I mean, just with the medication goal, you know, I knew that was your goal. And so I wanted to try and support you in that goal. And so I was trying to, and we had talked about it before. I was like, I'm not really sure how to support you in that goal. Like, if you're hurting really bad, do you want me to be like kind of a hard nose? Like, let's try and do this first. Or do you want me to just kind of, so I wasn't sure. I was playing it by ear. But you were hurting pretty bad. So I was like, I'm going to draw a bath just like in case, you know, we had read that a bath is like a change of environment and that can help just to reduce the pain because you're changing something or doing the laughing gas first. And so it's like, I don't know, maybe either one of those she'll want at any time. So I just started the bath. But you were hurting real bad.
Yeah.
Like 40 minutes after that conversation. And you're like, call the nurse, I want drugs.
Yeah. I was like, I want to do something. An IV dose. I'll do like, maybe let's just try a one-time IV dose of something.
So she came in.
Yeah, she came
calling
in
her for the drugs.
Yep. And she was like, okay, I'll get the medicine. But I got to check you. We can't, do that too far along because that will pass quicker than like a epidural or something.
Yep. And he'll be lethargic coming out.
So she got the meds, came back in, checked me, and she was like, oh, time to have a baby.
Yeah.
You're complete.
Yeah. She got the meds. She came back. She was like, just so you know, in case, like, if you're fully dilated, we're not going to be able to do this.
Yeah. And I was like, I had a feeling that I might be because right before she got back or right when she came back, I started feeling that like rectal urge to push.
So this was like at 11:30 or so.
Yeah.
She came back with the meds, checked you, and was like, baby's coming right now.
So she called everyone in there because she had like not prepped because everything moved so quickly. So they needed like the warmer table set up, the surgical table set up for the OB.
So all of a sudden 8 people show up in the room. Yeah. And like people are buzzing around getting everything set up.
And
then the doctor checks
to all of it.
You, and it's like there's a little bit of a lip.
Mm-hmm. She's like, there's still an anterior lip on your cervix.
Yep.
So you have a little bit of time.
And then everybody leaves.
Yeah. They're like, okay, nothing's happening. Goodbye.
Like in 3 minutes.
Yeah. And so she was like, if you can sit still, they could do like a spinal, a little block. So I was like, okay, let's do it. I will try, So they call anesthesia. I know this anesthesiologist, work with him all the time. I like him, so that was good. Mm-hmm. And
he was wearing Vans.
Yeah,
like
I didn't
cool
see
guy.
that, but anyway, so I have to sit up, and so I was like contracting while he was like prepping his stuff. I was like, okay, let me just get through this one, and then I sat up and was like leaning on Shelton.
The needle wasn't as big as I remember it from my nursing rotations.
Well, it wasn't an epidural.
Yeah.
And he did a numbing, like a local block
I know.
with just lidocaine.
Yeah.
Before he did the...
Yep. I saw the regular needle for the lidocaine. But then he had a larger needle, but it just wasn't as big as the epidural needle.
Yeah.
Which I was kind of thankful for.
Yeah.
Whenever, on my nursing rotation, when they did that, the guy passed out. And I didn't think I'd pass out, but it is a big needle going in your spine. It's like...
But so, and then I was like, having a contraction while he was doing something, and he's like, are you contracting? I'm like, yeah. And I'm like, he's like, okay, try and be still. I'm like, I'm trying.
Mm-hmm. You did a real good job.
This is like I know he has a needle back there, so I want to be like as still as possible, but this is so difficult.
I'm standing beside the table. You're sitting up on the side of the table. You've got your arms draped around my neck.
Yeah.
Just trying to give a picture.
Yeah. So he was able to give me like a small dose of something. He said like would last like an hour and a half because we were already so close, and you don't want to be like fully numb for the pushing because you need to be able to engage the right muscles and know what you're pushing. So, but that started kicking in, which was such instant relief for like, because I had a few more big contractions before it was time to actually push. So,
within a couple of minutes, your legs are feeling heavier.
I could breathe again.
Yeah, things kind of calmed down. It was real intense energy prior to that. It's just like, like this is going to happen at any time, and you're in such severe pain. Yeah. And then you kind of
so stressful.
Were able to relax
feeling.
And so then the doctor came in right after.
And then my blood pressure was
dropping.
Dropping.
Yep. So they got
So that's when she, I think, kept turning me.
Yeah.
Was right after she thought she was gonna have to give me meds to bring my blood pressure up a little bit, but
yeah,
the anesthesiologist was there and he was like, she's not symptomatic, like she's not nauseous, she's, it's okay,
Yeah.
like it'll come. And so it came back up and
yeah, it dropped from 143 or whatever over 87 to like 96 over 50.
Yeah.
But there was only one pressure that was 96 over 50, then it was in like the 112s.
Yeah.
So it was fine.
And then it wasn't long.
But then the doctor came in and was like, okay, let's try and take advantage. Let's start pushing, like try and get this baby out before the spinal block wears off.
Mm-hmm.
So they took out the pad in the middle of the table and got you on the stirrups. And then she re-instructed.
Yeah, she gave me instructions before the block. And I was like, in one ear and out the other.
Mm-hmm.
I was like, I don't remember anything she said.
Yeah.
So.
What were the instructions?
The instructions were to my hands behind my knees and try and kind of pull my knees towards my chest. And then take in a big breath like you're going underwater and hold it in and then bear down. And then she wanted to do like 3 pushes for every contraction.
Mm-hmm.
So they would kind of feel my belly and I could kind of tell when a contraction was starting to build. It obviously wasn't as intense.
Mm-hmm.
But then so we just started doing that.
Mm-hmm.
And
and they were monitoring it on the screen, which you could see. And then she had just 2 fingers in your vagina and would feel like your vagina tense up, I guess, when there was a contraction coming. So she would initially, when you were feeling it the most with the medicine, she was telling us when to start.
Yeah.
Because she could feel it before it would register on the machine.
Yeah.
But then, like, half an hour, 40 minutes into pushing, you knew better than she did. Like, you were feeling it before she could feel it.
Yeah.
And so you would lift your legs up and start again.
Yeah.
Mm-hmm.
He's such an active sleeper.
I know. I think he's okay.
And so things were fine for like the first like half hour, 40 minutes of pushing. It wasn't like she was kind of giving me instructions, but I was doing well. Mm-hmm. She said basically on the muscles I was using.
Yep. There's a little bit of a learning curve in the beginning.
Yeah.
Like with the pushing, it seemed. I obviously didn't feel this, but she was like, there it is. Like that's the spot.
Yeah, it was usually like the
into.
Second push of the 3 pushes per contraction.
And
was
you
like
said like
better.
I need to take a. Like, I feel like I need to poop or whatever. And she was like, lean into that. Like, that's what you should be pushing. That's what it should feel like.
Yeah.
I just thought
that was
kind of
just like so much rectal pressure.
Yeah. Because it made a big difference whenever we could see the baby's head. When you would push, like, and she was like, oh, that's good. And you felt it the way you were supposed to feel it. Like, the head would kind of come up and out, more than like just straight out. Like, it would head towards the vagina.
Yeah.
Yeah.
Yeah. And they would, be like, you're so close, keep going, like we can see his head, and like that felt like it went on forever though.
I said that like 6 times, but it always seemed very close.
Yeah. Well, you take like 2 steps forward, 1 step back every time. It's like they come out and then they go up a little bit, and then they come out a little bit more. And
it's very slight though, and his head is much bigger than I expected it to be. I kept thinking like we're real close, and then I was like, oh shit,
there's
like,
more head.
There's a big head.
Yeah.
When you first saw his head though, it was just like this tiny little, scrunched triangle with all these little skin folds.
Yeah.
And hair.
Yeah.
And I was like, something's wrong. Like this is not what a head should look like.
A head.
But it's amazing how much it, scrunches up to squeeze through.
Yeah.
But then when he came out, he didn't have a real triangle head or anything.
It wasn't too cone heady.
Yeah, or cone heady, yeah.
But so then it was like trying to get through under my pelvis, his head to come down. Mm-hmm. And so we got there.
And so you got the epidural like 11:45. Doctor came in. Spinal block, excuse me. After already being 10 centimeters dilated and pushing on yourself on your own, naturally doing almost all of it by yourself. You got the spinal block at 11:45. You started pushing like roughly midnight.
Yeah.
And then Julian was born at 1:13.
Yeah.
So it was fairly quick, all of it.
Fairly quick.
Yeah.
I mean, I feel like an hour of pushing is potentially long, but I think that's what, like, I didn't tear.
Yep.
And so I think that helped prevent that, because it gives the skin and stuff time to stretch and accommodate, versus like if you just push super fast and the skin was like normal and then just stretched out, it tears more.
Yeah.
But
And so sorry, you go ahead.
no, I was just gonna say so until like the last, I don't know how long it was because time was irrelevant, but I don't know, 20 minutes of like crowning and trying to get she said, it was just through the rest of the skin stretched over was the most excruciating part.
Yeah.
Well, I don't know compared to the contractions, but
it was like a bulge, your whole, like a baboon butt, like it's like pushing out and then it comes back.
Yeah. So it was just, like the skin stretching, it was like the most intense burning sensation, which makes sense. It's like nerve type pain.
Yeah. And you were like, I know how tough you are. A lot of people listening may not know how tough you are, but I shut your arm in a car door several weeks ago, which was really horrible. It was obviously a total accident. But it hurt you really bad, and you were just real quiet and kept to yourself for about an hour, and then it went away. But you were like panic crying towards the end of this, saying like, I don't think I can do this. Like it was hard to watch. It was just knowing how tough you are.
A panicky feeling of like, just things you have never felt before. Yeah. And you're like, I would rather be dead than feel this again.
And you said several times before you got the epidural, I think I'm going to die.
I mean, the contractions were intense.
Yeah.
But it's a crazy.
And so the final push.
That was like so hard because leading up to that, when I would rest, it was like a little bit of a relief compared to pushing, because you're like, you push and it's like more painful as it progresses, but then, okay, you rest for a second and it's a little bit let off, but at the end it was not, even when I rested, but I had to rest because then it was like I would lose my breath and I couldn't breathe and really push. And I was panicking and, but it was still so painful just resting. So it's like I wanted to push through, but it was so hard to like mentally be like, okay, keep pushing into the pain that is going to get worse. Or it's just like you don't know if it's going to get worse, how much worse it's going to get. You already feel like you can't tolerate anymore and like,
yeah,
I don't want more.
Yeah.
I already feel like you're at your limit. Yeah. So, and I was having to I was pushing down on myself like at the top because it felt like there was so much pressure on my urethra. I felt like my urethra was going to like tear.
Yeah.
And
whenever he was born, you like lifted up your hips as his head came out and you screamed. And then once his head came out, they started helping him out. They kind of pulled on his head and shoulders, and then his shoulders and body came out real quickly after that.
Yeah.
And at that point, you were up on all fours, crawling back like an exorcism. It was wild looking.
It felt like an exorcism.
Yeah. And then immediately they put him onto your chest.
But it was also a massive relief.
Yeah.
Like once his head came out and everything, I could feel like, the flow and everything moving. It was a massive relief. So, but yeah, they put him on my chest and they're like, look at your baby. And I'm like, give me a second. I just like, just need a second to breathe.
Yeah.
I'll focus on him in a second.
That was wild.
Yeah.
It was emotional watching you suffer that much, and then, seeing it's just so much going on,
Yeah, it's chaos.
It's chaos. And I'm glad you got the spinal block in the end, because it would have been so intense.
The whole time.
Without, yeah. And
yeah.
Like concerning, because it was already concerning in the end with the spinal block.
Yeah. I think part of it too is you just don't know how long it's going to go on. You're like, okay, I could do this for another 10 minutes, but I can't do this for another 2 hours. And you just don't know how long that pain is going to last. And so it's hard to judge, but they kept saying like, okay, remember this for next time you go fast. So
yeah, we're
everyone was surprised how fast.
3 days early. Well, technically 2 days early, because
he was due the 19th, but he was born on the 17th.
And he came pretty quick. You labored for, basically it started at 5, but it really started picking up after like 9 or 10.
Yeah.
So
once my water broke, it went really quick.
Yeah.
But.
And then I cut the cord.
Yeah, Shelton got to cut the cord.
Julian was laying on your chest. I cut the cord. And then I was
To
looking
birth
at
the
the
placenta.
doctor was looking at the placenta, making
Well,
sure
we
all
had
the
to birth
parts
it
were there.
first.
Yeah, you birthed it.
Which was really not that big a deal.
Yeah,
I mean,
and I didn't even notice
it
that
was
was going on because I was
uncomfortable
looking at the baby.
because it didn't. She was having to push on my belly and kind of massage it out because she felt like
They push
the
deeply on the belly
cord
too. It
was
seems.
like she felt like it would tear or something if she pulled too hard. So she was kind of like trying to help it detach.
Yeah, they
but-
pushed real hard on the belly and they got the placenta out. The
Yeah.
placenta was beefy red, beautiful placenta. It looked like something from Meow Wolf. The way like the top of it was purple and blue and
yeah.
kind of rubbery looking.
Yeah.
And it was heart shaped. And the doctor was like, "That's kind of cool. It's heart shaped." Trying to think of anything else that happened right then.
So after that, then she kind of inspected everything.
Mm-hmm.
And she was like, you just have some like micro superficial tearing, nothing that needs stitches. So I was very relieved about that because I knew that would mean another like needle in there to numb.
Yeah.
And then obviously it changes recovery.
It went shockingly well for your first baby.
Yeah.
You're set up. You're a good baby maker and good baby birther.
Apparently.
You know?
Well, so far.
So far. Yeah.
We're one for
but
one.
I think the first one's got to be the hardest one as far as labor and delivery goes.
Yeah. I don't know. But yeah, then we did skin to skin for an hour. So basically like chilled for an hour.
Mm-hmm.
Not much was going on.
Yep. My parents were driving in from Texas, but they were in Colorado Springs briefly. So they were driving in and they're night owls. So they were arriving at like 2.
So they were in the parking lot.
So they came
chilling
in the parking lot until things kind of calmed down. Came in and saw him about 2:30 or 3.
Yeah, after the our skin to skin, then they came in and like weighed him and cleaned him up, and then Shelton did some skin to skin while the nurse helped clean me up, get me up. I was able to pee right away without a problem, so that was
nice.
great.
Yeah.
And then it wasn't long. We moved to the mother-baby unit upstairs.
Yep. And they swaddled him and put him in the little crib next to, and the mother-baby unit was nice, and they did a good job for us of...
Yeah, we had a great nurse, both L&D and mother-baby.
Both of them were
I
great.
liked all of our nurses.
And they gave us plenty of space up there. It's not like people were bugging us all day. It was like every 4 hours.
Yeah, they would come do our vitals.
Yeah. Give us good education on the lactation side. He latched pretty quickly when he first came out. Like as soon as they laid him on your chest, he was lifting his head and looking for the nipple, and didn't he nurse a little bit?
He nursed a little like 10 minutes after.
Yeah, so he
was born.
Hungry boy, ready to go. And I thought that he'd have a floppy head, surprising neck strength.
Yeah.
He was immediately like rooting around.
Yeah.
I like as soon as they laid him on your chest, I was like, is he supposed to be able to do that? That seems like he's hours older than he is.
Yeah.
It's mature beyond his minutes.
Yeah. So.
But good experience in labor and delivery, or the mother and baby area. We stayed there for a day and a half, basically.
Yeah.
We had him early in the morning. We were moved up there at like 3:30.
Yeah.
And then slept, chilled for that full day. And then in the evening they gave us it's like
celebration
a celebration meal. It was a good steak dinner.
Yeah. We had some friends that worked in the hospital that day, so they just popped by,
That
brought
was
us
pretty
coffee.
cool. Yeah. My parents hung out. And then we slept there again for the second night. And early in the morning, because they have to do 24-hour checks, they woke us up at like 1 in the morning the next day, because that's his 24-hour mark. And they did their hearing test and weighed him and measured him again, and a couple other things. And then we went home at about noon, and that was all good. His first night here was good. The second night was kind of the night of the feeding frenzy, which we weren't told about and didn't know about. And so the second night that he was here was a little bit intense.
Yeah.
Because we didn't know exactly how to appease him, but it turns out he was nursing a ton to bring the milk
help
in.
bring the milk supply in.
And so now we're day 5 or whatever, 6.
Yeah.
And we're figuring stuff out.
I don't want to be cocky. We're not, we don't have it all figured out.
We don't have it figured out at all. What I'm saying is we are figuring
it out.
We are
learning
just
mistakes.
Now. We're finally well rested enough to feel that we can learn new things and put new things in our brain and try and adjust to this new life. So we're trying to, the big thing we're working on today, and which really started last night, is getting him on a better day and night schedule.
Yeah, and sleeping in the bassinet.
Yeah.
And
just we're leaving him in the bassinet.
Trying to get him more comfortable, because obviously the first few days it's like he's been in my body for 40 weeks. It's hard for him to adjust to just like be totally separate.
Yeah, and he was just nursing like constantly. And even if he wasn't nursing, he's like fall asleep with your boob in his mouth and just stay there.
Yeah. And then if you try to move him, then he's crying and awake and seems to want to nurse again. And like, the first couple days I would sleep like an hour or 2 at night. Well, it was just...
And that was another thing that was amazing is your like energy and endurance in the first couple of days. Because we got back from the hospital and that first day or 2, I felt wrecked. And I checked my recovery on the Morpheus and my recovery was like 38%. And you're like peppy. And you've had less sleep than I have.
Yeah, and my recovery was shit as well. But I think just the adrenaline and new mom stuff. And
mom stuff, mom superpowers.
You're just able to do everything sleep deprived and
and
not
we had
feel it as much.
A little bit of a, I guess you call it a scare, but it's just new parent stuff, just us not being educated. Because his umbilical cord stinks, smells like a wound.
Yeah.
And both of us kind of have wound experience, so that kind of smell was concerning.
Yeah.
And
part of it was detaching, and so I could see drainage coming out.
Yeah. So
and it's too early for it to detach.
Yep.
And so
we went to the pediatrician, and she said this is all normal. It almost always gets bumped and detaches, and it stinks.
Yep.
But that was one of the things that we weren't educated on, that it would stink. And a friend of ours
I think if it stays attached, it wouldn't smell, like the way that it does.
Well, maybe
as
so.
Intensely.
But my friend who also had a baby recently, David, said that the midwife, I don't know how much information he wants to give out, but anyways, you're familiar with their situation. They did a different birth thing than we did.
Yeah.
But he said they were educated.
The midwife just told them about it. Yeah. And
I think,
it may be in stuff and paperwork, and it's just...
That's true.
There's a lot of information you're given.
That's true.
So...
Yeah, but those are the only 2 things that I feel like that we weren't really educated on. When we went to the pediatrician's office the day after the night, or the day after
we went
the
on
night
Saturday
that we had the feeding frenzy or whatever.
For his first, they just kind of check his weight and make sure things are looking okay.
And they educated us then on because we're like, is he supposed to feed for like 10 hours a day? And they're like, well, right now he's trying to bring the milk in. So this is normal, day 3 to 5.
Yeah.
There's like what we call the feeding frenzy, and he is super hungry and we're going to bring that milk in. So, but we did not know about that. No,
but I did read about that during my, not panic, but Google searches when he's crying and we're up all night. And so I was like, okay, I'm pretty sure this is normal. And then the pediatrician confirmed, everything when we went the next day. And, but it's just a lot of, tons of new information.
It's a lot of stuff.
I mean, even like I've been watching some newborn YouTube videos and I'm like, I could watch that again. I think I retained, 70% of it maybe, or even less. And
yeah, so much valuable stuff on YouTube.
Yeah.
That video we watched yesterday, it's just basic information, but about the scheduling and stuff, that kind of made me, I was just thinking like, we're just getting by, but it's like at some point you don't just get by. You adjust the schedule, you figure stuff out, you're implementing,
Yeah, and that video was helpful because they have like a pediatrician talking about stuff. They have a pediatric like clinical psychologist. They have a lactation. They have a L&D nurse. So they have like the whole team giving their input on, okay, this is all normal. This is what you should try to do. This is,
and there's a 12-minute video on all the stuff, bathing and sleep schedules and how to change a diaper and all that kind of stuff.
Yeah.
We started cloth diapering
After he,
after his meconium stuff.
yeah,
a couple
went
days
away
in.
and transitioned.
And that's going well. It is tough though, just not all the time. Sometimes I forget to tuck his penis.
Yeah.
And if you don't tuck his penis, he pees up. And then if the diaper is not like tight enough on the belt line, it'll go into his
on his
jammies and stuff.
Yeah.
So that's happened a couple times. So there's learning curves there. Ton of laundry
Yeah.
with cloth diapering. But
Well, and just the clothes, and then we get pee on his sheets, and
Yep.
you know, everything has to be changed like twice a day.
Yep, which is fine with me because I
Sheldon
love
loves to
laundry.
do
I've been
laundry.
basically preparing for this
Yeah.
my whole life.
Yeah.
Um,
Our water bill's gonna go
and I'm
up.
able to wash, like if I go to jiu-jitsu or exercise or whatever, which has been great. I kind of thought that I would be more needed than I am. I'm not super needed, which is great. But the first couple of days was a little bit of an adjustment. I was like, man, like the baby just needs Lo. She's the primary birthing person. But like I had a lot of free time that I didn't realize that I would have. You know, you're nursing all the time.
Yeah.
And I'm like, I'm helping however I can. I can change diapers. I can get her food. I can, you know, do that kind of stuff. I can organize stuff. And
Yeah.
but anyways, I've been able to work out and ruck, and
Yeah.
so it's actually been pretty nice.
But last night, I feel like, you know, you did more,
Yeah.
but I was really tired and at my wits' end last night.
Yeah. I could feel that.
So,
And last night was the first night that you didn't really ask for help. You know, before you were waking me up, and then last night I think it's maybe you're just kind of done with it and feeling whatever.
yeah.
But I woke up and I was like, why aren't you asking for help?
I don't know. It's hard. It's a lot of new stuff.
Yeah, for sure.
So, but
Yeah.
it was, you know, overall, you know, I think as good as it can be for labor, and he came out healthy, and
We'll edit that out.
he came out healthy, and you know, everything is we're adjusting.
Yep. Yeah, things are going great. We love this baby boy. Best thing that's ever happened to me.
Yeah.
To you?
Yes. Yes.
To both of us. He's great. We named him Julian
Coffee.
Coffee Holmes. And the coffee comes just because I read this book, The Empire of the Summer Moon, and it talked a little bit about Texas Ranger history and kind of cool Indian history stuff. And so Jack Coffee Hayes is the Texas Ranger that the name came from. We're not naming him after Jack Coffee Hayes.
Yeah.
Exactly.
But just like the initials, we already had Julian picked
Yep.
out, which
Yeah.
is just kind of a name that we like.
It is a nice name. I
And
like the
then
name.
the initials were the same,
Yep.
and
Julian Coffee Holmes.
coffee
Jack
is like
Hayes.
a little unique,
Yep. And we like coffee.
and we like coffee.
And also, we want him to be a rootin' tootin' cowboy.
Yeah.
We
And
want
you
him,
said he came out quick, you
and
know.
he came out quick, so coffee's appropriate.
Yeah.
Yep.
So,
There's all kinds of reasons. But also, we just like coffee's kind of a fun middle name.
yeah.
So that's what coffee's about. We've
Yeah.
been asked that. Anything else?
That's about it. That's
All right.
that's our labor story.
That's our labor story. Thanks for watching. I feel like I've talked too much, so you maybe close it out.
No.
It's your labor story.
It's my I know, but you were there, and
Yeah.
you had a completely different experience than I did. Like,
That's true.
you know, I didn't see or watch everything that you did. It was
Yeah, you didn't have
a
an out-of-body
completely different experience. Yeah. I know they did offer a mirror, and I was like, no, thank you.
Yeah.
Uh,
Where would they have?
like sometimes to help, like if when
Oh.
you see the baby moving, it
Oh.
can help you if you're having trouble engaging the right muscles or
Yeah.
pushing. But
Makes
I was like,
sense.
I think I'm okay.
That's a real Jim Bro move.
Yeah.
Need a form check?
Yeah. So, but no, yeah, it's our, you know, I labored, but you were there and had a completely different perspective on
Yeah.
it. So,
Yep. Well, cool. Love you, babe.
love you too.
excited to be doing this with you.
Yeah.
And perfect timing because he's opening his eyes and moving around now.
Yes. Time to wake up.
Time to wake up.
Be alert for 30 minutes.
Yep.
Go back to sleep.
Time to do some tummy time.
Yeah.
All right.
I'm trying to get a pop on.
That's the end of the podcast.